Deep breathing
I'm going to
podcast.
do the whole episode in one breath.
Up in the upper register.
Yes. In the early 1920s. I know it's your favourite period in history.
I love it. Everyone's driving old-timey cars, although they weren't old-timey at the time.
No, they were new-timey.
They were new-timey.
And they go, Auga!
I know that there was a little bit of a thing a little while ago where Bogan's got the Aruga horn.
Fucking
but
funny.
That's
I love them.
so cool.
I would get one.
So cool. You would get one, but
no one would believe I was angry. It's like, Auga, get out of my way, you shithead. It's like,
no, if you don't need to invent time machines when you have those.
No, you don't. So welcome to the All About Old Horns episode. So early 1920s.
Yes.
A strange and bloody illness slowly spread through the cattle farms across Canada and the United States.
Just slow down for a second, because I just have to say that bloody can mean like that's an expletive that just means more.
Literal.
But when you put it with illness,
Literal.
It's not nice.
It's not Australia. It's not nice. Bloody illness. It's a bloody
Okay.
illness. So yes, spread throughout the cattle farms of Canada and the United States.
Okay.
So otherwise healthy cows would suddenly become sick, often only after very routine procedures like, and this is gross, like dehorning.
Oh.
Apparently that's routine.
Well, I'm sure.
Or it was. And they'd collapse in pools of their own blood, which didn't normally happen.
I'm hoping it doesn't.
Not
I'm
a good
hoping it
farming
doesn't.
practice.
Oh, God.
So the disease would wipe out entire herds. It would destroy farms, ruin their incomes, etc.
No doubt.
Yeah. And farmers were at a loss. They're like, what the fuck? So let's fast forward again. Now we've gone forward to a Saturday afternoon in 1933. So 13 years later.
I wasn't that wedded to the 1920s. Like you said,
I know,
generally the
move on.
1920s. Like you could have just said in the 1930s now.
Before the 1930s.
Yeah,
then,
okay.
So now we're in 1933. We're at the University of Wisconsin's Agricultural Experimental Station.
Yes.
In Madison
Okay.
of the Wisconsins.
Yes.
Specifically, we're at the lab of the biochemist and renowned expert in plant carbohydrate chemistry, Carl Paul Link,
Okay.
who you know well, obviously. This is just going to be like telling you what you already know.
Yeah, okay, that's fine.
He was doing a little after-hours work with some of his research students on this Saturday afternoon.
Again.
Actual work.
That sounds terrible euphemism time. Just move right along.
Actual work.
Okay,
Actual
well,
science
let's
work.
just say he had some science work that probably required monitoring around the clock, as
Yes.
some science work does. You know, you can't fit science work all into the 9 to 5.
No, you can't. Science doesn't work that way. Science works better when you're knackered.
No, I'm not saying knackered. I meant more that sometimes you have your experiments and you have to check them every 4 hours.
Yes.
Or if you don't, the world ends.
Definitely
So,
what social science is like.
Surveys at midnight. Does anyone administer surveys only
Oh, no,
midnight?
it's a great album, though. We now have a title for our first Wholesome album.
Sorry, listeners.
God,
Sorry.
that'd be dreadful.
I will get him on track.
So Link, Carl Paul Link, was
Yes.
by all accounts an excellent teacher and researcher, but he was a little eccentric and a tad outspoken,
Okay.
much like us. He taught with a flair. He dressed to attract attention. So he liked, as they put it, non-traditional clothing.
Colourful racing identity.
Exactly, colourful. He had large bow ties, flannel shirts, work shoes, and even shorts
Shorts.
in the 1930s,
In the
at a
1930s.
university.
So this is Depression era, and he's wearing the large bow ties.
It's verging on, like it's a bit sexy. At one point, apparently, it seems he even, I quote, acquired a cape and knickers, which, when combined with his flowing locks, gave him a distinctive appearance.
Can I just double check here? I think there might be a translation error in knickers.
Yeah, I do too.
Knickers might mean something different in the 1930s to what I'm imagining. He's got the cape and underpants. Because if you go if you teach at a university right now, and Rod, knowing that you have just filled out your working with vulnerable people check, I think teaching in a cape and knickers is pushing the boundaries.
Yeah, it's fair to say they've sent it to a higher authority to double check if that's okay. He was boisterous, flamboyant, spoke with a booming voice. When he lectured, he directed his remarks to the students, not the blackboard, which is apparently remarkable. He would actually turn and face them rather than just squidge on his...
You've remarked.
I know.
Okay.
So that's what... And he'd work really hard to keep people's attention while he was also injecting their, inquiring minds with information. So he would sometimes say outrageous things like slurs at the university admin.
So he's a short-wearing, cape-wearing, flamboyant, talk to the students, be a decent guy.
University
man of our
bagging,
hearts.
pithy quote
Man of our
doing.
hearts.
Yes.
I don't know where he's going to get to in this episode, so let's assume he stays awesome, and therefore we can give him honorary wholesome status in the past.
I don't want to ruin the surprise, but in this instance, I don't think he's a terrible man.
How could he? He wears shorts to work.
Well, who doesn't, though? He was described by those who knew him
Terrible
as a
people.
very generous, kind, and thoughtful person. He was also a prolific letter writer, and he loved a good argument, but it was also a big tease.
Big tease.
Again, they don't mean sexually.
He's just waiting to give the meaning of the story a little bit later. Yeah, that's fine.
Yeah, that's just how he rolls. He also apparently had a bit of a temper, though. So there was a story where he gets jealous of people he got jealous of people who received attention, and he particularly liked a fella called Harry Steenbock.
Mm-hmm.
He was doing vitamin D research, and he got patents and fame for it. And Link didn't like this.
Was you haven't mentioned what Link was really doing research in?
We're going to get to that.
Okay, all right.
Not quite vitamin D, but he was still, as I say, he's a renowned carbohydrate chemistry person.
Again, that's why I forgot. Maybe you did say that, and I heard
carbohydrate chemistry.
Yeah, I didn't. I remembered the bow ties and the shorts.
Yeah,
and plant carbohydrate chemistry. I'm sorry to say that it didn't stick. It didn't stick.
So he didn't like this guy Steenbock, and a story went around his department at the time where he was throttling Steenbock in the men's room. Again, not a euphemism. He was actually strangling the guy.
Okay, I know times were different.
I'm off to throttle the Steenbock is really it's a bit clunky. And apparently the audience was limited for he figured to view him doing this, so he dragged Steenbock into the hallway where everyone could see him. Basically,
hang on,
throttling him.
This isn't good enough. I need an audience for this thing. Okay,
as a warning to others, watch what I do.
Was this just because Steenbock got the vitamin D research published, or was there something else going on? Because I feel like even professional jealousy, that guy got the publication, that guy got the grant. Yeah, it's not quite enough to throttle someone.
We've bashed a few people who've had that happen to them, so to be fair, come here. Son of a bitch. So anyway, that's a bit of a flavour of the personality who is running the lab this Saturday afternoon in Wisconsin in 1933. So many years later, Link wrote an account of what happened that afternoon himself. It's like 2 decades or more later, so I'm going to draw a fair bit on this.
So there I was. Cape and knickered.
Exactly. Bow tie in hand.
Cape and knickered with my students.
Flowing locks. So, as he puts it, so I'll chime in and out of quotes from him. On a Saturday afternoon in February 1933, while a blizzard was howling and the mercury was hovering near zero, a farmer from the vicinity of Deer Park, Wisconsin, some 190 miles from Madison, where Link was, appeared.
Mm-hmm. Okay.
The farmer's name was Ed Carlson.
That's all farmers in Wisconsin.
It really is. What's your name? Ed? I thought so. Carlson. So the hemorrhagic sweet clover disease of cattle was rampant on his farm.
Hemorrhagic meaning bloody.
Bleeding like the nuts. But he'd fed sweet clover hay to his cattle for years, so he didn't believe the vet when the vet said your cows have the hemorrhagic sweet clover disease. He's like, well, that's balls, mate.
It can't be.
Yeah, balls.
Can't be.
So he was basically told he should go to the Agricultural Experiment Station authorities, where Link was, etc., to get the facts.
Yeah.
So when he arrived, the office of the state veterinarian was already closed.
So this is like a house, like the medical doctor. This is like a medical CSI sort of thing, but it's a vet CSI.
Yeah, 1930s cow house.
Yeah. I'm surprised they haven't made the TV show yet.
I wonder if they have. I didn't find one. That would have been easier than reading, God, I tell you. So the office of the state veterinarian was closed, and so by pure chance, Carlson wandered into the biochem building.
There's a guy in cape and underpants.
Yep.
It's Link.
Going, students, work with me on Saturday. Carlson had with him a dead heifer, so big cow.
I know a dead heifer is the technical term here, but it's certainly a thing.
It means something more now. A milk can containing blood completely destitute of clotting capacity.
Ooh.
Milk can full of blood that would not clot.
It stays runny.
Yep. And about 100 pounds of spoiled sweet clover, the only hay he ever fed to his cattle. So that's what he brought with him. In
all of these things, he's bringing more volume than you need. I get that you need the whole heifer. like you can't just do a diagnosis on the nostrils or something like that. But
yes, I've just brought the nostrils with me.
I don't know.
I know what he'll need.
But 100 pounds of the sweet clover. I think you could have gone a little bit lighter there.
And a milk can. Milk cans aren't small.
No.
If I remember my old
I got all of
timey
the
milk
blood.
mains.
All of the blood.
I got a shitload of blood, a body, and 100 pounds of spoilt sweet clover.
That's just how you travel there. You got a big ute, you fill it up. I get
It's
it.
Wisconsin in the 30s.
Yeah.
You know, you look idiotic if you didn't. So apparently his account of the overall course of the disease perfectly coincided with classic sweet clover poisoning.
Okay.
So it turns out...
An open and shut case,
Done.
some might say.
Job done. Anyway, thanks
But
for
no.
joining us.
But no.
Oh, no. But no. There's a but no. So it turned out, late in December, this is February, late in December, he lost 2 young heifers. Then in January, one of his favourite old cows developed massive hematoma on the thigh, and they did a skin puncture to relieve the bleeding. It just bled out, which is a bit gross.
That's the non-clotting.
That's the non-clotting. Finally, 2 cows had died on Friday just before he turned up, and his bull was oozing blood from its nose, so maybe the nostrils would have been enough.
At some point, he's thinking, I got to do something about this.
There's an issue,
Is it only when the man started to feel sick?
obviously.
The bull. He was ignoring the heifers.
Cows, plenty more where that came from. Ferdinand is now injured
Sexism in the
cow
cattle
industry.
industry. I think there's a fair bit of sexism in the cow industry.
Probably many others too. So he'd finally had enough after the bull started bleeding from the schnoz, so he hauled ass to Madison, even though there was a terrible blizzard going on. So he threw these things in the back of his pickup.
Yep.
His 1930s, here you go, pickup, and off he went. Link immediately said to Farmer Carlson that there's pretty much not more we can do than recommend the teachings that they'd learned from 2 Canadian researchers who'd been looking at sweet clover poisoning for a while.
Sure.
Their names are Roderick and Schofield.
I'm getting down the journal articles. It says it's sweet clover poisoning.
Yeah, duh. He said to Carlson, stop feeding them that hay and possibly transfuse the desperately sick cows if you want to save them, which, of course, all farmers could do. Just transfuse them.
You plug one cow into the other. Like it's just, you get a little windy pump.
Instead of milking them.
It's a hose that goes between one to the other. Just jam them in and then...
Yeah, it's simple. So Link goes on to say, when Farmer Carlson came to see us, my senior student and Old Man Friday,
okay.
normal post in academia back then, this was his name.
Is there going to be any clarification of Old Man Friday?
No, none.
Just
He works with him and he's a senior student. I assume he means
And
odd job guy.
they're different people?
Different people. Yeah, it's not a split
So
personality
there's the
situation.
senior student and then there's...
No, same person.
Oh.
The senior student and also Old Man Friday was a fellow called Eugene Wilhelm Schöffel, who was described as a volatile Schwabian who came to the US in 1926.
Schwabian,
so it's an
That's
area.
Germany.
Yeah, Germany.
Look,
Austria,
I'm glad that he's got a name, but I'm sticking with Old Man Friday.
That's fine by me. Or Eugen probably. So he started to hang out with Lincoln a couple of years earlier. He was, as Link puts it, he was then and still is somewhat of a mystic and inclined in ordinary conversation to quote freely from Goethe's Faust, Shakespeare, and the Bible, as well as other primary
Shakespeare
sources.
had some great stuff on cow bleeding diseases.
Oh,
though.
he really did.
Like some of the later chapters in Hamlet just go deep into all of the cow bleeding
And
stuff.
it was cut from A Midsummer Night's Dream because too much blood. There were too many animals.
Well, that's a comedy too. So you don't want a lot of blood in a
What's
comedy.
not funny about
I don't
cows
know.
bleeding out
It's
for no reason?
it's Puck and he's dressed up as a cow. Oh my god, it's a cow. How do you not know?
Puck's bleeding to death.
Yeah.
Now I know. In 1933, this is Link carrying on, the Old Man Friday spoken English was not only strongly guttural, but also very earthy, punctuated frequently with Schwabian German.
Okay.
As we're all familiar. So as after Carlson the farmer left, Schöffel stormed back and forth in the laboratory shouting, are you ready?
Are you ready?
What the hell? A farmer struggles nearly 200 miles in this weather, driven by a spectre, and then has to go home with promises that might come true in 10, 15 years, maybe never. Who knows? Get some good hay transfuse? Ach, God, how can you do that when you have no money? He snarled.
It's a depression. You don't have any money. You can't do any transfusions without any money.
No, can't do any of that. 10, 15 years. He dipped his hands into the milk can repeatedly, and while rubbing them muttered, there's no clot in that blood. Blood, verfluchtes Blut.
Look, I'm squeezing it together.
nothing.
Look, it doesn't clutch.
I shout at it and nothing. And then he added, after he
I do
quoted
like
past-
the Shakespearean. Like this is getting quite Shakespearean. The blizzard,
true,
the cows in the blizzard, in the depression, and now you've got the German guy with his hands full of non-clotting blood that just drips off. Look, it's just runny blood
and
running
running
blood.
his hands to the sky, moaning the horrors. And then he quotes Faust. Menschen deuren mich in ihren Jammertagen, which means people take me in their days of woe.
People take me in their days of woe.
I think he's asking for a little bit of a thing to calm him down. And then he says, what will he find when he gets home? Sicker cows. And when he and his good woman go to church tomorrow and pray and pray and pray, what will they have on Monday? More dead cows! He has no other hay to feed them, he can't buy any, and if he loses the bull, he loses his seed. Mein Gott, mein Gott.
This sounds like Old Man Friday is really developing the passions for this
He's into
case.
this shit.
This is his quest.
Yeah.
He's on the hero's journey right now.
You're not wrong. So he's, mein Gott, why didn't we anticipate this? Yeah, we should have anticipated this. This is how it's written. We took the blood and hay, says Link, and played about with them until about 7 p.m. Gross.
But sure, I mean, you don't get a lot of chances to play with blood and hay. It's particularly non-clotting blood.
And spoilt sweet clover. Oh, good time. What a Saturday.
Close the doors.
So Link goes on. As I left the laboratory, Sherfel grabbed me by the shoulders, looked me squarely in the face and said, before you go, let me tell you something. There is a destiny that shapes our ends. It shapes our ends, I tell you. I will clean up and give you a document on Monday morning.
Welcome to the Wholesome Show, the Science Stories podcast for people who sit up the back of the classroom.
And in which we do the pointless and racist German accents, so you, dear listener, do not have to. Oh, and we ask questions.
Yeah.
I forgot that part.
And we've got non-clotting blood on our hands.
All over us.
Yeah.
You can tell. That's how we know we're evil.
The Wholesome Show is me, Will Grant, and...
Me, Dr. Roderick Griffin, Sweet Clover Lamberts.
Sweet Clover.
That's my new name.
You can't have... No, don't do that.
That's how I write.
Don't do that.
Sweet Clover. I'm
Don't
getting
do
it on the
that.
side of my car.
Don't do that. Don't do that.
Beautiful.
The Wholesome Show is brought to you by the Australian National Centre for the Public Awareness of Science.
It is. And
For all of your science communication needs.
from this end to that end.
Not just science communication, too.
No, we do other things, but we're not going to tell you what they are. You have to give us a call.
All right.
Call us.
All right. I'm imagining. I am gloved up. I have the blood on my hands and the
Destiny is at play.
I'm covered in a little bit of sweet clover hay.
Oh, yeah, you are.
And now I got to type out my paper.
And it's like, now we got a Saturday night for you.
and there's a blizzard.
Yep.
So.
Yep, and it's 1933.
Oh, he said he's cleaned up. I don't want to imagine that he said he's cleaned up. I will go home right now to my typewriter.
He's German. Of course he cleaned first. They were very clean people. It's in their national anthem.
What was his name? Oh, Good Man Friday. Old Man Friday.
Yeah, we never hear from him again.
Man Good Friday? We don't hear from him again.
Gone now.
Oh, so he's just the research assistant that is going to do the drudge work, and Link is claiming credit
Oh, there'll be many.
of claiming credit?
Yeah. Well, there'll be many workers. So if we go back to Canada 12 years back, Schofield, who I mentioned
Back in the
earlier,
Aruga.
back in the Uga times, Schofield was a vet pathologist, and he saw this strange hemorrhagic illness, and he saw that it correlated with wet summers when unusually damp hay was used as cattle feed.
Oh, okay.
And it became infected with fungal molds, in this case, penicillium.
Hey, what?
I know, right?
Hang on, that's one of them famous ones.
Not penicillin, penicillium.
It's the same.
Entirely different. This one's got extra I and it ends with M.
You can't just say most of the Latin word and say then it's different.
I don't know.
I guess that's the definition of Latin.
Yeah, if you change the word, it's different. It's true. Like fart
All right.
and fort.
Wet
only
hay.
have
Wet
one
hay's
different letter.
not good because it's got fungals in it.
So yeah, he connected the disease to the silage that contained large amounts of moldy sweet clover, but the molds themselves were actually harmless.
Oh, okay.
So he's like, huh?
Yeah, harmless
hell?
but not harmless. Sounds like they're harmful.
Well, we're into correlation here, aren't we?
Yeah, okay.
So the wet hay, the penicillium, but harmless. So Schofield then says, I think there's an interaction with sweet clover that infects the fungal strains and creates this potent anticoagulant that basically messes up the cows and causes them to bleed out.
Okay.
So
That sounds like it's harmful.
yeah, but not on its own.
Oh.
If you just feed them the mold, they're like, oh, whatever, this just tastes gross.
Okay. So they tried that.
Yeah.
They did try that.
Yeah, and it didn't do shit. So it was some combination that the fungus was affecting something to do with the sweet clover and creating this anticoagulant. So Schofield basically said, give him fresh hay.
Genius.
That was the solution,
Genius.
which is not always easy, particularly at the moment, because in the 30s, some farmers had followed his advice, but many couldn't afford to.
Well, I get it.
We're leading to the Depression.
At any point, sometime you run out of the good hay, the fresh hay, and you get to winter and you're down to the shitty hay.
And they didn't have fax machines, so they couldn't get it faxed to them then.
I am an expert on hay storage,
I know.
and one thing I do know is that eventually your stores run down.
This is why I thought you'd like this story, given your expertise and indeed deep experience in the hay industry.
Hay storing, yes.
It's true, you're very specialist. So, people couldn't afford to just arbitrarily change feed or get new stuff often. So many farmers were skeptical of his theories also because they'd never had trouble with their silage before, their feed.
Something's changed.
And no one was able to isolate and identify whatever this hypothetical substance was that caused sweet clover disease.
So it hadn't happened before?
It doesn't appear to have, or at least there wasn't a clear record to it. Maybe, I'm sure it must have happened, but people maybe weren't connecting it. There seemed to be a rage of it or something.
Yeah, okay. No.
I didn't go deeply into the history because there's so much forward to go with this. So we go back to Link. We're back into, the future, the 30s.
Bow ties and knickerbockers.
Absolutely. He's sitting there looking at the dead and still bloody cow on his laboratory floor, and Link remembered Schofield's publications on poisoning by sweet clover, and he thought,
could be the sweet clover. Let's investigate. Let's read the papers.
Yeah, let's check it out. And he decided to see for himself if there was a mysterious agent lurking in the hay, in the spoiled hay. So over the next 6 years, he and his students isolated compounds from the hay. They tested them one by one for anti-clotting activity or abilities in lab animals. And finally, in 1939, Link's student Harold Campbell isolated a substance that reduced clotting. So
okay.
I found
He's found something.
Yeah.
That's good.
So they called the compound dicumarol, or dicumarol. Dicomarol, we'll call it.
Go with all of those names.
Dicoma, kuma, wabba, 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 shamalama, ding dongarol.
No, don't do that. Don't do that.
Dicomarol, that'll do.
There you go. That's fine.
They called it that because it had a structure that's very similar to coumarin, which is a bitter taste.
That's what I was going to say.
I know you were.
I was thinking that you hadn't said the structure yet, but I obviously had visualized it in my mind.
It was your time to shine, and I'd stepped on it. I feel bad. Let's start again.
No.
Hit pause. So this coumarin is a bitter tasting substance you'd find in plants like cinnamon, and especially it's abundant in sweet clover. So dicomarol is a structure similar to this thing that's already found. As others had eventually demonstrated, penicillium mold converts coumarin, this benign thing, into dicomarol, an anticoagulant that is deadly in large doses.
Do I need to get like a whiteboard out or something?
Yeah, that's just, all you got to remember is he found a thing, there's a connection, something goes on with the sweet clover, turns into this substance.
Thank God. Thank God. Because
No
I needed the psychom explanation, not the chemistry one was.
There was a thing in there that got messed up, turned into this other thing that they've proved was
better.
bad.
That's better.
Yeah. And I should say a lot of this comes from an article by Rama Rajagopalan, writing in Science History Institute. It's really interesting. A lot of it, not all of it. So Link and his students went to develop a method for synthesizing this dicomarol. And
why do we want to make it? Isn't it the baddie?
Well, they're kind of curious about it. And
it's the baddie. It's the baddie.
Yeah, it was like, mega smallpox, COVID. We just got to synthesize these things and see what
I'm not. Are there scenarios where we need our blood to be less clotting?
We're going to get to that.
Oh, okay. All right.
I know. So his students developed heaps of different analogues and variants of it. So they had heaps, and they started to obviously feed it to lab animals because who gives a shit?
Dicomarol, tricomarol,
multicomarol,
quadricomarol,
ultra, superior, megacomarol.
Yeah, nice.
That's more recent. So some of the analogues that they produced were even more potent than the dicomarol at provoking internal bleeding, lab rats, mice, and rabbits. Lucky.
Lovely. Sounds lovely.
But on the whole, they couldn't really see the impact of the bleeding inside, so they'd have to wait till it came out in their stools and then in their urine. And more often, when the external signs hit, the external signs of internal bleeding, they were in pain, they were dizzy, they were disoriented, they would faint as their organs shut down, and repeated doses would make the animals collapse and obviously die.
Again, I know that animal ethics has moved on since the 1930s, but surely we have to justify the reason that we're putting these animals through this. I mean, is there a purpose?
Oh, yeah, it's great.
Okay.
It's gold. You'll love it.
Cool. All right, cool.
You seem suspicious.
I do. I feel suspicious. I am suspicious.
So Link examined the results, and he realized that dicomarol, or variants of it, could be really useful on operating tables and in post-surgery because it could prevent fatal blood clots in people.
There you go. Thank you. See, I needed to know that. There you go. That's fine. Kill all the rats you want.
Yeah, fuck them.
Kill them all.
Make them suffer.
Yeah, just
science.
Really do it. Really do it. Go to town. Go to town. Because you've got a reason now.
But what about the rabbits? Do you okay with the rabbits?
Were there rabbits there too?
Rabbits, mice, rats. No people. Yet. So in 1940, there was a mob called the Wisconsin Alumni Research Foundation, or WARF, and they funded Link's lab. They made dicomarol available for clinical experiments on humans.
Okay.
Researchers at a bunch of hospitals in America and Canada did a few studies on how it worked in human bodies, and even the president of WARF benefited because he had a bit of dicomerol after gallbladder surgery.
It's just an alumni association.
Yeah.
I being the president of WARF doesn't sound like the greatest title in the world.
Here's my guess. Shit tons of cash. That's my guess.
Yeah, really?
It's an American uni, of course they've got money. I mean, you know, they philanthropize.
I don't think so.
Maybe not. So the drug, the need for this anticoagulant became more and more common as World War II hit America in 1941. And then there was an editorial in The Lancet that basically, as they put it, catapulted it into the international stage. And the writers suggested the drug, which you could actually take rather than have to inject, you could just take it orally, could be better than the anticoagulants they use now, which had to be injected. So you could just swallow a bit.
That's good. Have this. Yeah. Pop this pill before you have some surgery, and you'll bleed a lot.
Yeah, or afterwards, like, oh, you might coagulate. Take this.
Too much coagulation. Is that a problem?
Yeah, clotting.
Yeah, I know, a little bit too much.
Yeah, so basically, if you clot after certain surgeries, they get into your heart and brain and shit and causes aneurysms and things, and then you're fucked, mate.
There you go. That's great. Thank you. You needed to tell me that.
Yeah, so coagulation can be good and bad. It's a double.
We want the middle path.
We want semi-coagulate.
Yeah, too tight and it doesn't work. Too loose and it doesn't work. The right. Tune the bowstring.
Are you talking about blood now?
I'm just in general, the middle path. The middle path.
Okay.
Yeah.
I don't know if I believe you. I think you're being specific. Moving on though, dicamerol was far from a perfect drug because you needed very high doses of I love the quote, cow poison, to reduce clotting in humans, but too much would of course cause dangerous hemorrhaging. So
a drug that you have to get the dose right.
You need the right amount.
It's weird. It's weird that there are drugs that you need to get the dose right.
Revelatory.
I can't imagine a doctor just giving you some amount of medicine.
Take this. I don't know how much. A bunch.
Whatever you feel like, really. Yeah. Like a shovelful or a pinch. A pinch. Maybe try both.
How much can you swallow? Take some of these fake pills.
How much can you fit in your mouth at once? like just one solid mouthful.
Practice. I got a bowl of grapes. Yeah. Now you practice with this.
Pop them all in. Yeah. I'll hold you closed, and then you got to chew.
Oh yeah, no cheating. You got to pinch your nose.
I think we've established that most medicines probably you need the dose about right.
But this is the olden times.
Even for pasta, you need the dose about right.
No such thing as too much.
Yes, there is.
So good. God, I like pasta. So the problem is, I suppose, with this one, some drugs, if you take too much of them, it's just a bit ick. Whereas this would make you bleed out and die horribly. Okay. But the problem was that so you needed high doses, and if you fucked up the high dose, you would kill people. It was unreliable in emergencies because it was slow to absorb into the bloodstream.
Ah, okay.
But Link had a hunch that of all the other variants, there might be a better one. So they had all these analogs. He's like, surely there's a better one.
Yeah.
So one of the versions of the drug was created by a couple of his students, and it was called imaginatively Analog 42.
Oh, that's
the one.
No, I like that. Analog 42. It's
Analog
like
42.
Blend 43. It's cool.
Oh, the best coffee.
Yeah.
So Analog 42 was so much more toxic in lab rats than researchers they started going, it's so toxic, this could be great for killing rats.
Should we need to? Is this some sort of, you have a rat plague?
Pest control. So Link went, this could be basically a better mousetrap, as he put it.
Yes. Okay. Cool.
So WARF, the alumni organisation, helped file a patent for it, and Link said thanks very much, and so he named it Warfarin.
Warfarin.
In honour of the foundation.
Yeah.
That's where that name comes from.
Oh, there you go. I have heard of that one.
You have?
Although I thought it was pronounced Warfarin.
It can be called Warfarin.
I like Warfarin.
Okay, Warfarin. Actually, it should be Warfarin. We're going out warfare.
Yeah, that's a bit much.
We're going to go and do a bit of warfare. Anyway, it was much more effective than any other product because it was slow acting and it was lethal over repeated doses. So perfect for rats.
But it's a dose. Like it's a chemical. It's not some sort of biological thing.
It's a thing. And so basically rats wouldn't become bait shy after they first ate it. They'd eat it, they'd come back, they'd eat it, they'd come back, they'd eat it, they'd come back, and eventually they just die dead elsewhere. Whereas strychnine and zinc phosphides and stuff, if they had a little nibble and didn't like it and didn't eat enough, they'd rack off and never touch it again.
Okay, yeah.
And you probably have used variations of it. The rat traps, the rat poisons. They say these things go away to die, and you're like, oh, cool, not my problem.
I don't know if I actually have.
He has.
I don't know if I actually have.
You're a rat killing bastard. What's it called? Rat fucker, as in killing them.
I don't.
Too much. So they kept returning to the bait until they'd eaten a toxic amount. They just keep scoffing it until finally they couldn't because they were dead. But
saucy. Beautiful.
The upside was in small quantities, it barely affected larger mammals. And regulators said, it's probably okay around kids too.
That sounds great.
Yeah.
When you might be paraphrasing here, but
I am
I do like the regulator saying it's probably okay
Should
around
be
children.
cool.
I mean,
That's all right.
who'd want to check?
Don't worry
Who'd
about
want to check?
Here,
Probably.
kids, eat some of this. Nothing. Eat a bit more.
We did a bit of thumbs up, and
That's why we have at least 2 children.
it always is.
Yeah.
An heir and a spare.
Exactly. So, no, they just said basically it seemed okay. So, 1950, the news of this new rat poison reached an industrialist called Lee Leonard Ratner. And Ratner, of course, saw dollar signs. He's like, this shit's going to be
He's in the
awesome.
rat business already.
He is, exactly. He's the Ratno. He should be the Ratno. So, he got a licensing agreement with the Wharf mob.
Yep.
Formed a company to market warfarin, but they called it D-Con. D-Con. I don't know why. Lowercase D-C-O-N, capital.
Decon. No.
I don't know why.
No. All right.
But anyway, they called it D-Con.
Look, I did actually, as a sidebar, I did look into drug names as a potential wholesome topic one time, and it's freaking boring. I thought it'd be really cool, like that. There's some wacky.
Yeah.
No, it's not.
There's a database of clowns sitting in a lab going.
No, no database of clowns. No, it's really sadly boring.
It's disappointing.
But decon sounds nice.
Decon. I mean, it sounds sciencey, I suppose, and it's got the hard syllables, so it's like death.
Oh yeah, definitely. If you're wanting to get rid of a problem, decon will solve it.
Decon your rats.
No, it's no fluffy cloud. It's
maybe warfarin sounds too nice.
It doesn't sound that nice.
That's why they should have called it warfarin. In late 1950, Ratner put on a public demonstration in Wisconsin, in a town there, and within 2 weeks, the baits of decon that they put around the place eradicated the rat infestation in that town.
Hey, cool.
Took him out. 2 weeks. So, of course, this propelled...
Did he release rats, or did he just go there?
Well, maybe that's another episode.
I just like the public demonstration. He did check there was rats there before.
Doesn't it? No, apparently they had an infestation, so he waltzed on in and sort of piped it.
I can solve your problem.
Yep.
Monorail, and
I will whistle the rats away by making them bleed to death where you don't see them. So, of course, there was a coast-to-coast advertising campaign on the radio. Decon became a multi-million-dollar mail-order business. The pest control was in churches, homes, basements, grocery hardware stores,
everywhere.
Barns, farmsteads of rural America, all over the place.
Because no one loves rats. No one is saying, I want more rats.
No, not as a rule. I mean, maybe some do. I know people who've had
like
pet
pets.
rats.
Pets, that's different. But,
and the classic, though, they've got
rats.
pet rats. I have friends who got pet rats years ago, and I was thinking they're going to get out and breed everywhere. And I didn't say it, but I thought, it's going to happen. And like a week later,
it's pregnant.
The rat got out.
Yeah, I know.
Did she? Next thing you know, guess.
Yeah.
Anyway, so in the meantime, Link was very well aware of dicomerol's therapeutic shortcomings. So everyone was going, no, we're not happy with that original one that fucked people up. So he started to re-examine his data on warfarin and thought maybe it would be a better drug for people. So he encouraged hematology colleagues to start trials on warfarin, but they said, screw that because it's dangerous and it's a rat killer. We don't want to do it because they're using it to kill rats, so we do not want to put it into people.
But if they're on the surgery table, they don't know.
Yeah.
Like, can't you just give it a different name?
That's how it works.
You call it the happy human.
Yeah.
Like you can have decon, sounds really tough against
blood
rats.
Be good.
Yeah, blood be
Take
good.
this blood be good.
The nice surgero.
Yeah, exactly. No Klotsky.
See, we could get into medicine naming. This would be so much more fun.
Let's do our own. We'll get a bunch of brands and we'll rename them.
No. That's yeah. I just want to talk to people that are developing medicines, and we can help with their names. It'd be way more fun.
God, we're helpers.
Yeah.
I can't believe we're not quintillionaires because of all the help.
I don't know that you get that much money for naming a medicine.
Oh, we would. God, the names would be good. We could do some designs. So anyway, so the hematologist and stuff said we are not going to do clinical trials with warfarin on people. Screw that, mate.
It might work, but we're not going to do it.
Screw that.
Thanks,
it's a
buddy.
rat killer.
Thanks, buddy.
It's a
just
rat
because
killer.
it works.
Yeah, but it's kind of like, thalidomide. When people found other uses for it more recently, it's like, do you want to take thalidomide? I don't. What if I call it, it's cool now?
I know, but what if something is useful for a problem that is hard to get rid of otherwise?
I know. I agree, but you can understand the thinking.
I know.
So no one wanted to play. They said, no, screw that. Then, 1951, a 22-year-old military inductee, so a dude had been inserted into the army.
Sounds like he's going to have a happy time soon.
Yeah, he stumbled into the U.S. Naval Hospital in Philadelphia.
Sounds like a good place to stumble into. Like he's at least accurate.
Yeah. He was doubled over with acute back and abdominal pain and he could barely walk.
Oh.
Nurses tried to secure him to a gurney, and his nose was bleeding profusely, spilling all over his clothes. So
sounds like he's got some sweet clover.
Yeah, he was bleeding his date off. Probably literally, actually. After several hours, they managed to stabilise him, but they couldn't figure out what the hell had caused the bleeding. Some thought he'd been poisoned, but with what and who would have done it?
He ate all of the decon.
Well, finally, the young recruit, when he became lucid, the doctors, as they put it, pried the story out of him. He was depressed by his future prospects, and he was desperate to avoid getting deployed because he didn't want to be in the military.
Okay.
So he'd taken a small amount of rat poison. And the next morning he woke up and he was alive and well. He's like, oh, fuck.
Oh, so this was a suicide attempt?
Yeah, it was a suicide attempt. So apparently that didn't work. So he said, screw it. He took some more of the poison that night. And then for the next 4 nights...
That's what with the rats, you can keep coming back.
Just keep coming, exactly.
Keep
So he
back.
kept coming back.
He didn't get bait shy, which is a terrible thing.
He's like, I seem to be alive. I'm going to keep eating it. What I don't understand is why he didn't eat 3 packets. But anyway, so he kept taking more and more.
Oh, God.
You got to love sneaking up on suicide as a strange approach.
No, that's over a 4-day period.
Yeah.
Oh, that's horrible.
Yeah. And finally, 2 days before he turned up at the hospital, he said he had a sudden sharp pain along his torso. Blood began to spurt from his nose.
Which he knew was coming. Like
he knew something was going to happen.
But was he hoping that it would be an instant sharp pain and bleed out? Oh, God.
Yeah, he really thought he was going to die. But then 2 days later, the pain became overwhelming, but he was still alive. And he'd obviously taken warfarin. So this made the doctors go, hang on a minute, maybe warfarin could be useful. We're never going to use dicomarol again.
Okay, cool. So they just needed someone to attempt suicide on this.
Yeah, because they saved the guy, right? So he became known in the literature as EJH. I don't know why.
Oh, so they're like, okay, this is the dosage that would kill someone, and he took,
Yeah, they saved the guy. And they heard his story, and it was like, oh, he could keep on taking it, and he didn't die, but it clearly affected him. So they gave him blood transfusions, and they gave him vitamin K, which was a known antidote for too much dicomarol as well, the previous drug. So he recovered really quickly. And so it showed them that vitamin K was also a really good antidote to both of these drugs.
That's awesome. All right.
So this could be useful.
Good. That's the most...
we can turn it off and turn it on again.
Most productive suicide attempt ever.
Didn't work, though.
Well, I mean, it's productive in the sense of saving the world.
Yeah, and I don't know if you say someone successfully suiciding is productive.
I'm not... Well, he didn't successfully, did he?
No.
He didn't die.
Or unless he went on to later, but that didn't come up.
But anyway, his horrific story had a silver lining.
It really
Can we go, there was a silver lining?
For other people, it certainly has. So the availability of the antidote made the doctors go, wait, so warfarin doses sufficient to kill rats could be safe and even therapeutic for people with clotting disorders. So take a little bit of rat poison, but not too much. And the doctors could start to test it, but what they needed was a pure form of the drug now. So they're like, we want to do it. We want to test it.
Not just buying it in the rat pellets. Like we might something a little bit less with the dead rat on the box, more with.
I'm seeing the assistant in the corner of the hospital room smashing up a mortar and pestle and trying to hide the label. No, nothing over here. It's really good. It's really good. A little bit of strawberry flavouring. You'll be fine. So Link convinced a buddy of his at Endo Labs to do enough clinical grade warfarin to test it. So they did all the early trials, and it could do everything the old drug did, but with many times the potency. So it was much better than the old drug for that. So when arterial blood clots near the brain or causes a stroke, or could cause a stroke, warfarin could restore blood flow and prevent another stroke.
Yeah, okay.
So basically, you've had a stroke, take this, now you're not going to have a second. It's very common to get follow-up strokes.
Yeah.
So if patients were lying in bed after long periods after surgery, you'd stay still, you wouldn't be able to move, and you get clots from immobility.
Okay, yep.
So you take warfarin and the blood would be able to wobble around. It was just better in so many ways than the old drug. So that was great. It was ironically both a better rat poison than the old drug and better medicine for humans. Like all drugs.
Not ironically.
Probably perfectly. Yeah.
It's probably doing the same thing. It's just different dosage.
Yeah, and we're less rat-like than we're
bigger than rats. We can handle more. You have to take a barrel full.
Christ, I'm glad we are bigger than rats. So in 1954, 3 years after the guy nearly died, the FDA said, all right, these trials seem cool. We're going to make it okay for humans who've had clots or strokes and stuff. So that's cool. And it even got to the point where there was a new name, Coumadin, whatever, doesn't matter. Dwight Eisenhower was one of the first, if not the first, high-profile patient to use it. So he had a heart attack when he was on vacation in 55.
You don't have a heart attack on vacation.
He does, because he loves work.
That's dumb.
I'm not working. I feel stressed.
Or whatever reason, you just save your heart attack for work, and then at least get time off work.
And insurance.
No doubt.
You get your compo. So he already had a weakened heart and he had a heart attack. The doctors gave him the Coumadin drug, the warfarin, whatever equivalent, and basically he was fine. They kept him on a maintenance dose, so it was hailed as a grand lifesaver, etc. It's good for the president. So today it's still one of the most widely prescribed oral anticoagulants in the world. And the numbers I saw, around 1% to 2% of adults in the developed world take it.
Oh, wow.
Of people who take prescription medicine, 1% to 2% of adults take warfarin.
A lot of people take prescription medicine.
They do. But that's a fair percentage around the world.
Oh, it really is. Yeah.
So the problem, of course, is it's a very fiddly drug. Yeah. So some patients need really low doses, like 5 milligrams a week. Others need as much as 70 milligrams a week to get the same effect.
People aren't normally, what are we talking, 5 to 70,
Wildly different.
14 times
hugely
in
different.
size.
I think that's 1,000 times more.
5 to 70.
Yeah, about 1,000.
It's not.
No.
It's
14, you're right. Fuck.
I know.
You got a PhD.
I'm basically Rain Manning over here.
I know.
To work out that number.
Like Einstein.
And you're just going, no, you can just guess. It's 1,000.
Yeah, 1,000.
It's not 1,000. But people aren't generally 14 times variant in size.
No,
people go from,
not usually.
Like 50 kilos to possibly 200 kilos. That's 4 times in size.
Yeah. Not 1,000. So, and they couldn't predict what people would respond in what way. They're like,
so it's not even size. No. You're a big guy. You need a little bit more.
Not necessarily. No, it wasn't just size.
You got runny, or maybe it's how runny their blood is already. Like, really running blood. Do
the eyedropper test.
You got loose.
It just fell out.
Floppy blood. A little bit more for you.
This guy, when you cut his wrist, you got to squeeze his arm, but this guy just falls out.
Stiff blood. What do you reckon you have?
Chunky blood.
I
don't know. I think I bleed pretty well.
Yeah, I'm A positive, but also
so am I.
But also highly viscous. I have really sticky blood.
I don't know if I'm viscous, but I'm A positive too. I came home and told my wife that I got an A+, and she's like, "You bastard!"
Hang on. You found out your blood type at the time when you had a wife?
Oh, yeah, I didn't know until very recently.
What the fuck?
I don't put myself in harm's way.
You are meant to know these things about yourself.
Like when you're tattooed a kid, on you, aren't you?
Yeah, like it's all over your chest. That is 100% of your chest is meant to be your blood type.
A+. What's that? It's 'cause I'm excellent.
You're meant to know these things about yourself.
I do.
Earlier than the stage when you get a... Because I think you should know it before 16, which is the legal age of marriage. I think you should know this.
Do you want me to upset you further?
What?
I still don't have a will.
You still don't have a will?
That's made him more speechless.
Look.
I'm not quite a grown-up yet, but I'm nearly there.
Oh my God.
There's a few things I need to do still.
My God.
One of them was find out my blood type.
What happens to your dogs?
They live with Kate.
All right, car crash. Terrible car crash.
They die with us.
What if
as they would like?
What if they're not in the car?
That's confusing.
But there might be them.
No, they'll be fine. People love them.
Okay,
fine.
People. They'll just eat the food in your house.
Then each other.
Whichever
one survives will be stronger for it, and they can have the house.
Cool story. That's great.
So in the 1950s.
But you have to specify that. You have to specify that to the government.
There can only be one winner. One of them gets to live and they get the house.
Go into a lawyer now and say, this is what I want. This is all right.
Oh,
so the dogs, it's the Hunger Games and they get selected.
I finally have motivation to do a will now. I never thought this would be the day, but now I'm in. So yeah, they couldn't tell who was going to react how. So in the 1950s, researchers were starting to say, we wonder, when it comes to DNA, different people's DNA might have an effect on how certain enzymes break down drugs.
Yeah, but I think there's a stage between DNA and enzymes. So.
Well, this is a 1950s science.
We've heard of DNA. Let's plug the DNA bit in there.
Yeah, we wonder if there could be something. And so these two geneticists, or a geneticist and a pharmacologist, said, okay, we reckon each person's unique code could have a different, the slightly difference in proteins and enzymes. Yeah. Some could lead to stronger or weaker effects, which is fine. But they knew shit all about genetics, couldn't really test it. So what do you do with that information other than go, could be DNA?
Yeah, but that's like you publish a theory first, and then you get the Nobel Prize.
Exactly.
Could be that.
And then you got money.
So what you do is you publish all the theories that are potential, and then that's it.
Yeah, just throw it at the wall and see what sticks.
Someone else go and do the experiments.
That's how it works. So in the 70s, doctors in, the Albert Einstein College of Medicine and Bronx Municipal Hospital, they found that age, sex, body size, and other attributes could play a role or do play a role in how you metabolize it.
And other.
Miscellaneous, other,
Yes.
more.
Yeah, okay.
So in the 70s, that was a step ahead. So not until the 1990s, till a Human Genome Project, could researchers actually start to get specific.
Okay.
So they finally got to answer what they call a 40-year-old question: how did the genes affect drug responses, and could they do something with this information? Because basically,
They better be able to do something with it.
you would hope so. And the thing is, blood clotting is really delicate and complicated.
Yeah.
At a micro level, it requires.
I don't want
a
to
lot
just
of
eat
stuff
rat pellets until
you find out.
Until I find out.
Oop, turns out that was too much. Thud. Yeah. So clotting's really complicated. It requires what they call a molecular cascade, which takes more than 30 enzymes and proteins, blah, blah, blah. That it takes a lot.
Okay.
And if you mess with even one of these steps in this cascade, everything stops. So it's very finicky.
I really didn't think it would be
No,
complicated.
apparently it is.
Just gets thicker.
Yeah. Yeah, so the researchers finally in the 90s said, we found the gene for warfarin's molecular target in the body. We know what it interferes with, and it's a gene that prevents the accumulation of vitamin K. Vitamin K, this critical thing. So it's like, oh, what do you know? And they basically sussed out that even slight differences between different versions of the genes that were relevant between people would affect people's response to warfarin a lot.
Okay.
And the effects could be catastrophic. But of course, getting the right dose isn't straightforward either. So that wasn't enough. So in the early 2000s, researchers looked at thousands of DNA samples and they found the two relevant genes, and they realized there's a large difference between many people and how they could function. And then in 2009, the International Warfarin Pharmacogenomics.
What?
International Warfarin Pharmacogenomics Consortium.
Okay.
You know, the IWPC.
The group of people.
This mob looked at thousands of patients from 9 different countries and concluded that genetic testing could make the dosing more accurate.
That's good.
So before you get a DNA test.
Oh, sure. Yeah, okay.
All right. So then the FDA approved an updated label for warfarin that recommended clinicians do a DNA test for all new patients on the drug.
There you go.
Which
Okay.
is the first one ever.
Is that the first DNA test?
No, it was the first time ever a medication explicitly said get a genetic test before taking
Yeah,
it.
wow. Okay.
Yeah. So that's pretty remarkable.
Yeah, that's awesome.
Yeah. And so you got to a point where, it's sort of, people started to, of course, develop tests, DNA tests for warfarin-related diseases, as you'd expect, etc. But, of course, it's not that simple either. Because the dose is the dose variability is partially due to DNA, but also environmental and social conditions can affect it.
What the fuck is the point of DNA if it can't actually tell us
Do everything.
what to do?
Yeah, just tell us exactly.
DNA plus body mass. I believe that.
How did you know?
That's what I thought it would be.
No, so it was basically diet can have a huge effect because it depends how much vitamin K is in your diet. So dark green vegetables, green tea, etc., high levels. So if you're taking warfarin, you've got to drop that shit back, and they found that out by accident earlier. So if you're on warfarin, you need a stable diet. You want to be careful of travel or weight loss programs because it changes your eating habits.
Okay.
And it can affect your sensitivity. So if you start taking it, then you lose a bunch of weight or start eating differently for a week, it could fuck you up.
Oh, Jesus.
you got to be right on it.
Medicine's just not as good as it should be.
This one's wild though. Like I was just reading this going, my God, how annoying. So today, warfarin, it's renowned for its rate of complications and it's a common cause of illness and death compared to other drugs. There's a big study that showed that around 11% of drug complications in hospital patients result from anticoagulant therapy.
Wow.
Yeah. And errors due to anticoagulants are more likely to cause permanent disability than any other mistake. 32% of permanent disabilities in fuck-ups with anticoagulants.
Jesus.
I know.
I think errors is a bit much, though, in the sense that it does sound tough. Like, just to understand this, that
Doesn't seem easy, no.
there seems like a lot of things going on here. It is just... You'd call it a misdiagnosis of something, but not necessarily an error. Maybe they are errors.
Or you could diagnose right at the time, then the person leaves and they change shit and you don't know that.
Yeah.
So this leads to the biggest hassle for patients, which is you need routine lab testing and constant monitoring if you're on it. And there's a quote, and there's a few other quotes I'll get to at the end, but from one person in Canada who takes it, and they said the disadvantages are just going in and getting tested. Like it's a pain in the butt because you constantly got to be tested. So often doctors will start patients on a low dose or a standard, then they'll tweak it. Some make it educated guesses, but for many people it feels a bit Russian roulette-ish. Suck it and see.
You look like a 5 milligram guy.
Yeah, look at you. You've got less vitamin K. You can tell by the colour of your forehead.
Yeah.
Like it's concerning. So there are some alternatives as of the early 2010s, but they They're trying to replace it, but it's not working very well so far. It's more expensive. Insurance, at least in the US, won't necessarily cover some or the others. They have their own side effects. So even after 6 decades, or rather because of the 6 decades worth of work, warfarin's pretty essential. So I mentioned the quotes. There's a couple of other cracking quotes, or at least interesting quotes, from people who've been taking it. It was collected by some doctors in Canada. When I got my warfarin, it dramatically improved my energy level.
Oh, it's cool.
But then you get a bunch of others that say, God, I felt like shit. Then they asked another one, would you take a different drug? And they said, I would feel insecure and I would want some testing done to make sure my blood is okay.
Yeah.
We have had our blood tested forever and we feel safe knowing. So there's a comfort in the constant testing as well. And my favourite quote is, aside from the fact that it's rat poison, it works. It's hard to get over that sometimes, but it does drift through your mind.
Oh, wow. Oh, wow.
I love the line. That'll be something you or I'd say. Yeah, well, it's rat poison.
Well, you know what? It's a chemical compound.
Yeah.
I'm okay, Yeah.
Oh, I don't mind. Like I'm pretty happy to submit myself to the doctors. And so in the end, what happened to Link? So just to close. So Link was he got a bunch of awards. He did very well for himself. National Academy of Sciences in the 40s, all kinds of medals from people I've never heard of.
New bow ties, new capes.
New bow ties, some stuff from the University of Edinburgh, et cetera, et cetera. The Lasker Award from the American Heart Association. So he did pretty well. But he got tuberculosis quite young, so apparently his work, especially in the later years, was hampered by this. So he retired in 1971. He was a lifelong pioneer of liberal causes in the non-Australian political party sense of the term. His wife was an active pacifist.
Oh.
And he died of heart failure in 1978.
There you go.
So that's what happened to Link. I don't know what happened to the Schwabian Man Friday, though.
I want to know about him. Oh, look, there you go.
There's a roller coaster of an anticoagulant ride for you.
There you go.
I
From the blizzard wilderness of Wisconsin.
Yeah, in the Hooga times, through to Craig Venter's DNA testing.
Yeah, that's awesome.
And beyond.
It's amazing these chemicals that you can be discovered, but it can take that long to not even perfect, to get it where it is now.
And I mean, you can imagine the weight of human concern when you go, look, I want to try this rat poison on people because I think it'll be good. And you're like, maybe you should change your pitch a little, champ. Maybe don't lead with that.
No, go with it. I'm gonna see. I want my doctor. I want my doctor to say, look, this is weird, but you know what? I want my doctor to be good enough at convincing me to be able to hold my hand and say, rat poison.
Yeah, you've got a clot. Yeah. Have you heard of rat poison? Yeah. Well, let's bring these two suckers together.
Wholesome Show is me, Will Grant, him, Rod Lamberts, brought to you by the Australian National Centre for the Public Awareness of Rat Poison.
Yeah, we should be more aware.